Ashley Randolph, founder of Glow Preemies and co-founder of Alliance for Black NICU Families. Welcome to AM Buffalo, ladies.
Ashley and Beth, thank you so much for joining me on this great day to talk about
Ashley Randolph. Join us now.
Ashley Randolph, founder of Glow Preemies and co-founder.
This is something we do in the NICU literally all the time. Putting down an NG tube so that a baby can eat. It's just a necessary evil to the practice. As nurses, we tend to do some mean things to babies, but it's going to be better for him in the long run so he can gain weight and get chunky enough that he can learn how to eat and go home. She's doing a really great job with this technique. Honestly, using 2 hands is a great way to do it because you can't strain and push it back out when you're holding it in. And swaddling them really tight is super important.
Hold me closer, hold me fast. This magic spell you cast. This is La Vie en Roses. When you kiss me up inside.
All right, we're jumping on the trend. 5 things I would not do now that I'm a NICU nurse. Let's jump in. Coming in at number 5, make a strict birth plan. Nope, won't do it. Absolutely not. Babies come how they want, when they want. We can have educated decisions, but I prefer birth preferences. Number 4, I would not ask a NICU parent when they're coming home with their baby. Wouldn't do that. Not a good idea. Little insight. 1, they don't know, and number 2, half the time the team doesn't know. Baby's driving that shit. Number 3, if you are in your 2nd or 3rd trimester, I highly recommend before you travel anywhere for your baby moons or go to that cousin's wedding, check out the hospitals in the area you are unfamiliar with. Can't tell you the amount of times I have taken care of patients from out of the state and actually out of the country. Again, babies come when they want, how they want. Number 2, I wouldn't touch the vent without letting your RT know first. You know who you are. And coming in at number 1, I would not go into a perfectly happy sleeping baby's isolette, not gelled, in between care times at 06:45, right before change of shift, to do your assessment without touching base with the bedside nurse first. Okay? Good. Glad we cleared that up.
POV. You have to return to work 12 days after having a premature baby at 27 weeks. So that when she is eventually discharged from the NICU, you can spend what little maternity leave you have with her. You try to pump up work every 3 hours, but they're understaffed. Your milk supply is diminishing at 8 weeks postpartum. Will you even have milk available when she gets home? What do other NICU parents do? How can anyone afford to stay home during a NICU stay? How can anyone handle the guilt when you have to work and can't be with your baby? This is America.